Test. Especially when we get the 300 page
A call to order the open session of the August Board of Directors meeting. And could I have General Counsel read us out of closed session?
Sure. The board considered 7 items and closed. The first 5, items 5.1 to 5.5, there was no reportable action. And items 5.6 and 5.7, the minutes and the credentialing, both of those were approved on a 5-0 vote.
Thank you so much. Then we'll move on to item 9, any deletions or corrections to the posted agenda? Okay, seeing none, we'll move on to audience input, and this is the opportunity for members of the public to address the board on items that are not on the agenda. And if you wish to speak, we have a microphone at the lectern that you can speak into. If you'd please give us your name and you have 3 minutes to present your item to the board. I do apologize if I have to give you the wrap-up sign when it's 3 minutes. So we're open for audience input at this time. Know that we can't discuss it, but certainly we will be listening.
Hello, my name is Meg Hahn. It's good to be here again. I was hoping to use my time for public comment this evening to revisit the topic of burnout in the medical field. Thank you. This summer, the New York Times published a really insightful article titled "The Moral Crisis of America's Doctors," which took a deep look into how burnout is affecting doctors and nurses across the country. In addition, I recall watching a recording of a Tahoe Forest Health meeting last August where the topic of physician burnout and the statistics of just how bad it had been affecting the staff of Tahoe Forest was discussed in depth. From this article, which I'd be happy to send to anyone who hasn't seen it, it was clear that what we refer to as burnout is actually a much deeper moral crisis for many doctors. It doesn't matter whether they're working for-profit, not-for-profit, or hospital districts. This is an endemic problem that is obviously having a terrible impact on our communities and the nation's doctors and nurses, but is also putting at risk the future of providing quality medical care. Fully reducing burnout for physicians will require significant actions at the systems level. It is a multifaceted problem that will require a set of multifaceted solutions. But one way of perhaps making doctors feel more connected to their patients, to the community, and to the relevance and importance of their jobs would be for them to have some training and to be encouraged to discuss the health effects of climate change with their patients. Climate change is affecting all of us in different physical and mental ways. After all, the World Health Organization has said that climate change is the single biggest health threat facing humanity. We need to be talking about this more. Doctors and nurses provide a trusted voice and are natural messengers for connecting members of the community with the information and resources they need to protect and improve their health. There are reputable organizations that provide training and peer-reviewed resources for healthcare providers to educate their patients on the impacts of climate change on their health, as well as ways to protect their health in this changing world we're living in. I would like to strongly encourage hospital leadership and the board to explore this low-lift solution for giving the treasured medical providers of this community an opportunity to make deeper connections with their patients and to provide guidance on a health issue that is affecting all of us. Thank you.
Thank you, Meg. And just to, though we can't discuss it, I want to let you know that we are doing a multifaceted approach with our physicians in burnout. We recognized it immediately and put things into place for it, and to add another dimension would just help us even more. So thank you. We have another speaker.
So, good evening. Can you hear me?
Yes.
My name is Deirdre Henderson. I'm a Truckee resident, group leader of the North Tahoe chapter of Citizens Climate Lobby, and co-lead of 100% Renewable Truckee. It's good to see you all again. I have very good news for you tonight. Healthcare Without Harm and its affiliate, Practice Green Health, which we've previously mentioned to you, have just released a free and very comprehensive healthcare emissions impact calculator. This is a self-administered accounting tool specifically designed to enable healthcare facilities and systems to measure and track their greenhouse gas emissions, and that includes Scope 1, 2, and 3 emissions. This tool will enable Tahoe Forest to establish a comprehensive baseline measurement of its greenhouse gas emissions and to manage them for reduction over time. We request that you share this information with your administration and set an agenda item for the near future, for a near future meeting, for the administration to report to you on how this tool can be implemented by Tahoe Forest. As we've previously conveyed to you, this community is very concerned about climate change, and it will be very interested in the context of your master plan on how the plan will help to advance the community's GHG emissions reduction goals. In case you have any doubt about the level of this concern in the community, let me give you a few illustrations. As I assume you know, the town of Truckee has recently adopted and is working on implementing a climate action plan that reflects wide community input. In addition, a group of high school students, the Tahoe Youth Action Team, has built community support for and proposed to the school board a resolution to set specific goals and actions on school district energy efficiency, building decarbonization, and carbon neutrality. And the Youth Action Team is in the process of having a series of meetings with district administration about that proposed resolution. And in addition, the Climate Transformation Alliance has over 30 members, including the Truckee-Donner PUD, the Town of Truckee, the Airport District, TTSA, and many businesses and nonprofit organizations, all working together with the goal of reducing greenhouse gas emissions and doing our part to address climate change. Many months ago by now, we heard at one of these meetings of your interest in joining the CTA, but to my knowledge, that has not happened. So we request that we add to your next meeting agenda a report from your administration on progress made in effectuating CTA membership. As a public health care district, the public health effects of climate change and your own role in generating the greenhouse gas emissions that cause them should be a high priority of this elected board. Your constituents are interested in your accountability on this score. Thank you.
Thank you. We will pass that on, the calculator on to our staff so that they can take a look at that as well. So thank you. Any other speakers? Okay.
I'm doing this, Chair Wong, during public comment because I was unable to get on the agenda in time, my fault. But I wanted to take this opportunity to introduce to you, and I'm very, very proud and pleased and honored that we have the person that I'm about to introduce to you, our new Director of Marketing and Communications. As you know, Paige Thomason retired, and we did a search, and Meg Uri-Rab of Small Pond put her name in, which was a very pleasant surprise. And I'm just extremely pleased that she was interested in taking the job, and I'm going to give her an opportunity to introduce herself and share a few words with you, but you'll be getting to know her in short order. Meg?
Hi, well, I am very excited to be here. As Ted mentioned, I have been working with the district and specifically with Paige since maybe about 2008. So it's been a long time coming. I'm excited to move into this side of the role, but also my history with the district or the health system goes even further than that. I have been a full-time patient here since 2000. I gave birth to my son here, and I was even born here way back when. So I am, just thrilled to still be in the community and getting to know all of you, and I look forward to working in the future. So thank you.
Well, welcome. Welcome, Meg, and we look forward to hearing from you. All right, any other input from our audience? Okay, seeing none, we'll move on to medical staff. I'm sorry, input from the Employees Association. Okay, I see nobody from the Employees Association. So we'll wait, make sure our audience makes it out safely. And in that case, then, we will move on to item 12, and that's the Medical Executive Committee meeting a consent agenda, and we have Dr. Koch to present that to us.
So there's only one item on the consent agenda, and it is the urgent care privileges. The privilege form has been redone by our relatively new Director of Urgent Care. The changes were all requested by him and reviewed by the Medical Executive Committee and approved. And I'm actually going to defer to Dr. Evans, who's been integral in developing this, if there are questions specifically about it, because the form that I have misprinted and it's not clear what's old, what's new, what's lined through, and what's not. So I'm going to defer to Brian if you have questions on the privileges themselves.
Any questions about the privileges? Okay.
Can you tell us, though, who is the director of urgent care?
The medical director is Dr. Dave Lomack, and he has an extensive background in emergency medicine as well as urgent care medicine, and he's really practicing urgent care doctor as well.
Okay.
And he wanted to expand and enhance some of the privileges required and allowed under urgent care medicine. So we could go through it if you'd like, but I agree with the changes.
Okay. And how many urgent care physicians do we have are covering urgent care?
Oh, I don't know. Dorothy, do you know?
It's probably around 10.
10. And that includes advanced?
Have him come up to the microphone if you're going to grill him. Because they can't hear on the recording, sorry.
Oh, I was going to ask you about that,
We have
Mike.
the mic in there.
I'm told we have approximately 10 physicians.
Physicians,
that are
and then-
doing urgent care medicine. And then there's probably another 6 or 7, I want to say, APPs.
Okay.
So PAs and nurse practitioners.
And I think it's really interesting that urgent care is open from 8 till 6 and is used really frequently.
Yeah, it provides a great service.
Yeah.
Yeah.
How has our community adapted to this change? And are we getting comments of approval or?
Well, I think the community, the demand from the community really drove the expansion of the urgent care services in our system. And generally speaking, it's been very well received. People like to have another option besides having to go to the emergency department, for example, for things that are not quite to the level of an emergency department visit.
But for instance, at the old TTMG offices, I understand you can't have primary care or other services that you once had, so
Well, primary care will be in there. We will still continue to have primary care and urgent care services in the Tahoe City office, but for the summer, it's the primary care has been taken over to Olympic Valley, but that will reverse in November 1, I believe.
Okay.
Yeah. Good.
Any other questions from or comments from our board regarding the urgent care privileges?
Nope.
Anything from our audience? Okay, seeing none, can I have a motion to accept the Medical Staff Executive Committee consent agenda as presented?
So moved. Dale?
A second, please.
Second, Bob.
Okay, so it's been moved by Director Shamlin, second by Director Barnett, that we approve the meeting consent agenda from the Medical Executive Committee. All in favor?
Aye.
Right.
All opposed? So it's been approved, Dr. Koch. Thank you so much. Our next item is our consent calendar, and these are minutes and reports that are pretty non-controversial, but any board member or any staff member can pull one of the topics if they want a discussion on it. So anybody from our board that would like to pull a consent calendar item? Okay. How about anybody from our staff? Okay, I don't see any, well, got some public comment here. Does anybody in the public want to say anything about the consent calendar items? All right, then can I have a motion to accept them as presented?
I would move approval of the consent calendar.
Do you have a
Second, Michael?
So it's been moved by Director Brown, seconded by Director McGeary. I want to call you a doctor.
I know, I keep getting promoted.
As long as you don't burn out.
Be proud, right?
To approve the consent calendar as presented. All in favor?
Aye.
Aye.
All opposed? So the consent calendar is approved as presented. Now we'll go to item 14.1, and this is our biannual retirement committee update. And we have Brian Montanez from the, I can never remember.
Multnomah Group.
Yeah, Multnomah group. And I think he's going to be on Zoom.
Yes. Good evening, everyone. Thank you for trying. I know it's a different word. It's a different name. It's a little bit difficult. Let me pull up my screen here. All right. So you should be seeing my screen. And as mentioned in the intro, this is a biannual update on the Retirement Plan Committee's activities for the prior 2 quarters. And for Q1 of this year, the Retirement Plan Committee reviewed the performance of the investments, and the T. Rowe Price Blue Chip Growth Fund was recommended for removal by Multnomah Group's Investment Committee. The fund had recently changed its prospectus to characterize the fund as a non-diversified fund, allowing the fund to invest 63% of its assets in the top 10 holdings. We did not think that to be prudent. In addition, the new portfolio manager has underperformed since taking over in October of 2021. So we did our research and we came to the committee with a recommendation to remove and replace the fund with the JP Morgan Large Cap Growth Fund. After considering the analysis and the plan's investment and the option of the JP Morgan Fund, the committee accepted that recommendation and we made that change. We did our biannual review of the plan's investment policy statement. It was determined to be in good order. No edits were needed. And when I say it biannual, we review it every 2 years. We consider what we've learned in the courts. We consider what we've learned from legal counsel and our own internal technical services committee. We did not feel there were any need to make any amendments to the investment policy statement this year. We reviewed the plan assets to ensure accuracy of reporting. No issues were found. As updated previously, we've conducted a missing participant effort. For the 457B plan, there were 126 participants with undeliverable addresses, which constitutes a missing participant.
Wow.
55 of them were updated. That's actually a really good ratio. Generally speaking, we're only talking about 20 to 25% success rates in finding lost participants. For the 401A plan, 201 had undeliverable addresses and 83 were updated. Again, these are very good ratios in terms of being able to find lost participants. We also did a re-enrollment project, and I commend Tahoe Forest management team for initiating a project like this. On January 5th of 2023, Fidelity and the management team initiated a re-enrollment of participants deferring less than 6%. 57 people who had previously opted out, so were deferring 0, re-enrolled at 6%. Of the 57, only one person opted out. 116 participants were deferring less than 6%. 11 decreased back down to 6%. 2 people actually increased above 6%, and the remainder stayed at 103. The remainder 103 stayed at 6%. This is the power of inertia. In my world, in the retirement plan world, inertia can work against you. People just don't have the time to fill out the forms. They think they'll get to it tomorrow. They need to talk to their spouse about what to do. In this case, we flipped inertia and we used it to the participants' benefit by saying, we're going to put you in the plan. You are going to get the match from the hospital unless you opt out. So we use inertia to help participants save for retirement. Our fiduciary education for the quarter was investment mapping. So when we do remove a fund, what do we do with the money? And there are a few options. We did an education process on those options. Mapping means to take the existing money and future contributions and map or move that money to a new investment so that the existing dollars move over to that new investment and all future contributions move over to that new investment. In Q2, we reviewed the fund's performance. Everything was rated satisfactory by our investment committee. We reviewed the annual fee benchmarking report. Pay $72.95 per participant for plan services, and that is well within the range of 60 to 95. When I say 60 to 95, I don't mean 60 to 95 is the average of plans your size, because most retirement plans don't do as good a job as Tahoe at managing fees. This is if we took you to bid and we got the sharp pencils out from the national record keepers, what would they pay? What would they offer to get your business? And we think those rates would be between 60 and 95. So having a current fee of $72.95 is quite good. We reviewed a significant piece of legislation, Secure Act 2.0. This is probably the most comprehensive piece of retirement plan legislation going back all the way to 2006. We did an initial review to understand what was happening for 2023 and get ready for 2024. There were over 100 provisions, and they have different staggered effective dates. Some are 23, 24, 25, 26, 27, and 33. So each fourth quarter of every year, I will lead a conversation about the Secure Act provisions for the current year and to prepare for the coming year to make sure our committee and the participant population is aware of and has a plan to address the new provisions, either optional or the required administrative provisions. But yes, there will be 4 years of changes coming out because of the way the legislation was staggered over the next 4 years. Committee reviewed the plan assets. Everything looked good. And we created an administrative working group. So this is effectively a subcommittee. The 3 areas for the review are going to be a detailed review of the plan administration. We're going to dig into enrollments, administration, forfeiture accounts, missing participants, authorized representatives. We'll dig into the plan's daily administration. We'll also dig into the education services, where we don't have time at a full committee meeting to spend a lot of time discussing options and strategies. We will have time at the subcommittee or the working group to dig into what Fidelity can do from an education perspective, dig into the demographics, look out at calendars, when are open enrollments, what are the right times to do webinars, when can we get people on campus to work with our employees. So we'll take the time to dig deeper in. And then what strategic goals do we have for the plan or the committee? And a lot of this is going to focus on Secure Act, but should something change with Fidelity or should something change with Tahoe, we'll be able to spend time working on this strategy on how to execute. The administrative working group does not have authority to make any changes, so any changes that we recommend would have to be approved by the full committee. And the education was insurance and bonding, so insurance for you folks, the fiduciaries, as well as the committee are fiduciaries. You are not legally required to have bonding because you are not subject to ERISA. Summary of the plan as of June 30. Plan assets increased from 62.7 million at the end of the year to 71 million. So we saw a net increase in the 401A, the employer plan, of 8.3 million in the 6 months through June 30. As mentioned before, we did remove the T. Rowe Price Blue Chip Growth, and all remaining investments ranked satisfactory by my investment committee. For the 457B, the salary deferral plan, assets increased from 75.3 at the end of the year to 87.5 at the end of June, a net increase of 12.2 million. So the plan assets increased by over 20 million in the 6 months this year. That's a really strong growth rate. We use the same investments, so they're all in good shape. However, participation rates did decrease from 82.6 to 80%. 80% is still a very strong number, but we did see a decrease. But because of that re-enrollment that we talked about before, we did see an average increase for those deferring from 8.6 all the way up to 9.7. If you think about it, we affected over 100 participant savings rates, so that's how we were able to get a significant jump from 8.6 at the end of the year to 9.7 as of June 30. And just as a reminder, we do have automatic enrollment at 6%, which goes a long way at getting these numbers up. Add the employer contributions to the salary deferral contributions, and we had an increase from 13.5 total savings rate to 14%. Keep in mind, most financial professionals recommend between 10 and 15% savings for retirement. Your population on average is saving 14, so way north in that range. So your participants are doing a fine job and seem to be sitting in a very good position in terms of being ready for their retirement. With that said, I'll ask the committee, the board, if there are any questions.
Yes, thank you. I had a question. When you were looking to remove the fund that was going to go into focus, I think, on 10 positions, how many positions do you feel are necessary to have proper spreading of risk?
Yeah, generally speaking, in a U.S. diversified mutual fund, we're looking for north of 75. Could 60 be acceptable? Depends on the concentration in sectors and the dispersion between individual securities, but we want to see north of 75. We prefer to see north of 100.
And I assume that the group that you went to, the JP Morgan Large Cap Growth, meets that criteria?
Yes, it does. That's why our investment committee made the recommendation to the retirement plan committee.
Thank you.
Yeah, I had a question about the missing participants. Is there a point at which those funds are escheated to the state of California?
So escheatment is the absolute last step to take. I would not advise the committee to escheat the assets because two things that are both significant. In working with the committee and understanding the local mail system, it's been explained to me that the U.S. mail in the Tahoe area is not reliable. So I would not want to escheat somebody's assets just because their mailbox fell down or their person. These aren't my examples; they're the committee's examples. Or the mailbox person just didn't understand that the person lived there. Second, there are several initiatives, both public and private, and by public I mean legislative, to create national databases for lost participants. So in the next 3 years, as part of Secure Act, we're going to see a national database be created by the Department of Labor that we can use, even though we're not subject to the Department of Labor. We'll be able to use to say, hey, Tom Jones is missing. We can't find him. We followed the Department of Labor's guidance on what to do. Can we give you the assets? And then there'll be a national database for participants to go to. There's also a private database that's been created now that we can that we could transfer assets to. But I would rather wait for both of these to have more experience and get them up and running. The private database has only been created within the last year. So I would not recommend escheatment to the state. That effectively becomes a lost asset, but I would recommend waiting a couple of years for any truly lost participants before we transfer their assets. And as I mentioned with the success rates, generally speaking, 20 to 25% is a good success rate. Yours are north of 40%. Those are really good success rates, which comes back to what I've been told about the local post office. And I would rather continue to try to find them than to remove their assets.
Okay.
Brian Dale here. Can you tell me about the current makeup of the committee?
Sure. We have CEO, and my titles may be a little bit wrong, so forgive me. President, CEO. We have the senior HR person in Alex McLennan. We have the CFO, and I believe Dee Dee Holmes is benefits manager. So we have the 3 C executives: CEO, head of HR, head of finance, and the benefits manager.
Okay.
Okay.
Any other questions from our board? Any questions from our audience about the retirement plan? Okay, again, this was only for discussion, so we appreciate your report, Brian. And keep our fund going.
See you in 6 months. Take care.
Thank you.
Thank you.
Item 14.2 for discussion is a report from our, the Executive Director of the Truckee Tahoe Workforce Housing Agency, and we have Emily Vitus here.
Whoop.
Which I understand this may be one of our last times seeing Emily.
It's the first time we've seen each other in person.
Yeah.
All right, so we get to sit for this, huh? Do I need to turn this
I
on?
turned them on.
Okay, you can hear me okay? Great to see you all in person. It's been 3.5 years that I've been showing up on Zoom with you all.
Yeah.
And now my final presentation is with you all in the same room. So wonderful to be here. Again, Emily Vitus, the Executive Director, the outgoing Executive Director of the Truckee Tahoe Workforce Housing Agency. Before I start tonight, we're here to give a general update on the organization, but also to introduce our new Executive Director. I wanted to thank you all.
You have been the leading organization in helping this agency get off the ground over the last 3.5 years. You are the leading organization in helping us found it between 2018 and 2020 with Ted's support, and your employees have just been outstanding. Alex and Crystal and Ted and Martina and Sarah and Harry and many, many more. I'm also employed by the hospital, and so is Heidi. So we've just been, welcomed and supported every step of the way. So thank you very, very much for seeing something in this model and the vision for the Workforce Housing Agency. So tonight, again, giving you a general update on our efforts and the final drum roll of being able to introduce our new executive director to you. Are you progressing? Oh, great. So in January of 2023, the board of directors approved a new strategic plan. You are aware of the pieces of that strategic plan. I'm going to get into it just a little bit tonight, but we also changed our mission and vision, and the Truckee Tahoe Workforce Housing Agency facilitates workforce housing solutions for the Truckee Tahoe workforce. So part of that strategic plan was recognizing that our entire community needs housing assistance, our entire workforce, including your employees, and so making a very strategic shift to support both your employees and the other employees of those 7 member agencies, but also looking at the greater workforce that is working within the Truckee Tahoe region and seeing how can we take everything we've done already and just translate it to serving a greater community. So we're going to show you a couple numbers here tonight, but that expansion has been going great and the execution of the strategic plan is going well also. Just a quick stop on the board and staff. I know that you already know the makeup of this organization, but we do have 2 new board members. Kirsten Kramer, the new superintendent of the school district, has now joined our board and will be joining us for the first time at the September board meeting. And then Stephanie Holloway is the new deputy CEO for Eastern Placer County. And she used to be with the county as, I believe, a planner and engineer. She is now kind of leading things for Eastern County. She is wonderful. She was on our hiring committee to welcome Heidi on as the new executive director. And we just have a really, really strong board that is very involved, supportive, dynamic, and really good when it comes to governance and running public agencies. So that's been very helpful in founding a new public agency in the Truckee Tahoe region. Really quick on our annual budget. So the board did approve, it's actually a $510,000 annual budget, of which $430,000 is the member fees that are coming from our 7 member agencies this year. So the hospital's number is kind of hidden there, but as the largest employer in our region, 1,300 employees, based on that employee count calculation that we use, you do have the highest annual member fee. You'll see by the numbers, you also have the highest assistance rates as it relates to helping your employees access housing solutions. This year we did make a change on how we calculate that. So 75% of our budget is calculated based on employee count. 25% of our budget is now a foundational, all 7 member agencies pay that same amount to basically account for, there's a lot of operations that everybody has an advantage from or that is just helping to run the agency on the day-to-day. So kind of a new member fee there, which means the hospital's fee did go down, about $20,000 to $30,000 this year. You all know this, but I always like to kind of start with, right now there are 3 main ways that we are serving the community while we're also working on acquisition and development, so the bigger stuff that is tangible housing units for our workforce. The first is just general housing support. We are the go-to housing resource for the Truckee Tahoe region. That looks like, for example, yesterday Heidi and I participated in a home buying workshop, 50 attendees learning about what it looks like to buy maybe their first home in the Truckee Tahoe region, all the assistance programs and everything else. So we'll talk about that here in a moment. At the end of the workshop, 2 hospital employees came up to me, one who is a single earner with 3 children and another who lives with her boyfriend and his parents and would love to own her first home. So I had a good conversation with them about what it looks like to participate in regional programs and potentially own in the Truckee Tahoe region. So that's that general housing support, general education for the entire community. On top of that, we have our access to rental homes and our home purchase assistance. Access to rental homes, I'll move on to the next slide and talk through that. We have 2 ways in which we're helping the community access rentals. One is just assisting them in accessing other regional programs like the Lease to Locals programs that the town and the county are funding. The other is we actually have our own home lease program that we've had for the last 2.5 years, and that basically unlocks additional homes on top of the Lease to Locals programs, homes that can't qualify for those programs. So how do we make sure that we keep them in our local housing stock and don't lose them maybe to vacation homes or outside remote workers? So our program is unlocking, additional 2 or 3 homes per month, but that's significant when you think about how many homes we've lost, especially over the last 3 years. So helping our community access rental homes and unlocking additional homes while working with homeowners, et cetera, to do so. Home purchase navigation. This is a new one this year. So as you all know, we've always helped people access home purchase programs. We've now made a very strategic decision to focus more on helping people access home purchase. This is because your employees told us in the last 2 surveys that they want to own homes. We know that not everybody can, right? But we can help them on their pathway to identify if they might be able to. And so we've taken this very friendly, as you can see in this kind of cartoon, friendly approach to the process because it can be really scary for someone to pursue home purchase for the first time. So we're providing local market guidance, helping them understand the market, access realtors and lenders. We're providing financial wellness and education. So your credit score is at 400. What does it look like to get it up to the 670 or the 700 that's needed to potentially qualify for a mortgage? Home buying education, like I told you, the workshops that we did yesterday, we do those on a quarterly basis. And then home financing navigation, connecting them to down payment assistance programs and our lending partners so that they have a trusted lender in the Truckee-Tahoe region to help them understand if they might be able to do this. So this has been a big shift for us. A lot of our time is going towards the home purchase navigation piece, and we're seeing some really great progress because of it. So just really quickly, these are those programs that I mentioned that we're educating the community on, helping them to access. This is very hard to see, but hopefully you will have access to these slides if you'd like to read further. There are 3 main down payment assistance programs that are accessible to the entire region. The Martis Fund Down Payment Assistance Program, Placer County Workforce Housing Preservation Program, and the Truckee Home Access Program. These programs give substantial loans and or grants to help people access homes in the Truckee-Tahoe region. The Truckee Home Access Program and the Workforce Housing Preservation Program offer up to $150,000 a grant. So just funds to help pay down the home and help people better afford them. So it's our job to educate your employees in our community on these programs and help them access them. We're also talking with the town and the county about what does it look like for us to actually become the face of these programs. The housing agency should be the go-to housing resource for the community. What does it look like for us to potentially market and advertise these programs in partnership with the town and the county? Finally, the item that's hidden over there on the right is Hopkins Village. We've talked about this project before. This is a middle-income workforce housing project in the Martis Valley. Homes are at $615,000, and we have helped 3 or 4 of your employees pursue home purchase through Hopkins Village, and I believe there's 10 homes left in Hopkins Village to purchase. So these are the regional housing programs. You also have your own down payment or home purchase assistance program. So in May of 2022, the board took action on allowing staff to unlock dollars to help with recruitment and retention of employees through a down payment assistance or home purchase assistance loan. That was $900,000 per year, and it is at CEO discretion. Staff asked the housing agency to come in as a partner to administer this program, and after creating some good guidelines in the program and working with Alex, Matt, and Harry, and actually Crystal and Jay as well, we have strong program guidelines, and we have closed 4 loans since February of 2023. We are actively working on our 5th loan right now, and we have administered about $800,000 so far in those first 4 loans. Currently, we have about $500,000 of that $900 left for the 2023-24 fiscal year, and again with one active loan for about $80,000 that we're working on. So far, we've been able to help kind of a wide array from PC tech to one of your upper management positions access home assistance so that they can better afford permanent housing in the Truckee-Tahoe region. I'm recognizing as I'm sharing this with you that we didn't actually present the program guidelines to the board. It's something that we've been working with on staff, but happy to talk through that or share that with you if you're interested, the specifics of what that program looks like. So these numbers are very hard to see, but every time I see you, I like to show you the numbers of Tahoe Forest, general public, other member agencies. And I had mentioned that, the member fees versus the employees served, you can see that those percentages actually work out very well. We've been able to work with more than 200 of your employees in navigating housing, whether it's helping them to complete applications to get into affordable housing, all the way to administering loans through the hospital's home purchase assistance program. Since we started housing operations in July of 2020, we are, getting close to 350 or 400,000 or 400 people in the community, which is 400,000, helping them with their housing pursuits. One thing I do want to point out is that general public column on the far right. That was just at the beginning of this year, right? We approved the strategic plan in January and really started to track our assistance of the general public then. So 112 people have come to us and asked for general housing assistance, home rentals since about February of 2023. We have helped 5 local families get into homes since we started tracking these numbers with our expansion to serve a greater workforce beyond our 7 member agencies. I also wanted to give you an update on the acquisition opportunity we are pursuing. We came to you in March of 2023 to ask for your participation and partnership in potentially pursuing an 8-unit complex in Tahoe Donner. And since then, the homeowners have chosen to hold on to the property. You know that this can be hard, right? Pursuing multifamily units for purchase. They are holding on to the property, and we're actually still working with them to see if there is a way for us to take that property over in 2024. So they're working with us in the town and looking at could we actually put more units on that parcel before they hand it off to the Workforce Housing Agency. Additionally, we're still looking at other acquisition opportunities. We'd really like 2023 to be the year that we're unlocking our first multifamily complex and actually have that as an asset or something that we're managing and helping employees get into. And obviously the hospital has been a very strong partner in helping us to consider those pursuits. One slide that I did not add here that I'm just going to mention really quickly is development pursuits. We do have 2 publicly owned parcels in the Truckee-Tahoe region that we are looking at bringing workforce housing development to, so that's that middle income workforce that we serve. One is over outside of town boundaries on 89, heading out to Sierraville, Hobart's Mill, owned by the Forest Service. So they've been a strong partner of ours for the last 2 years. And the other is owned by the school district. It's a 10-acre parcel over by the lake. And we're looking to bring on a development manager that will help us with land use planning all of the pieces. They can be our in-house expert to actually potentially bring some workforce housing to fruition that the Workforce Housing Agency will be able to manage and help people get into. Very, very quickly, I know I'm taking a lot of time, but we did present to you kind of that outline of our strategic plan, so that 2023 through 2028. We have 5 main goals, and I believe 5 or 6 targets on the next slide to help us get to those goals. So this is not a major shift from where we've been over the last few years, but as you know, the importance of a strategic plan allows us to start planning over the next few years to actually pursue tangible housing assets, development, acquisition, et cetera. So those 5 on the left side are kind of the big words that we're using as far as how do we pursue a bigger impact on the housing space in the Truckee-Tahoe region. And then these targets to get there. So the big one is we're looking to unlock $10 million outside of our normal member fees from public agencies and private contributors to help us do all of the things below. So we're looking at publicly owned land, privately owned land, acquisition of units, expansion to serve the entire workforce, and state advocacy efforts as it relates to middle income workforce housing. So the group that doesn't necessarily have a lot of government funding coming to it on the housing side of things. This plan was approved in January of 2023, and we are actively pursuing all of these. We'll start giving annual updates at the end of this fiscal year on progress on this strategic plan. And finally, it is my last presentation to you all. We have finished a multi-month pursuit of looking for a new executive director. My husband and I are leaving the Truckee-Tahoe area, sadly, but Heidi has been in the area for a very long time. We've worked together in the housing space since 2016 and is a dear friend. Heidi was most recently at the Lake Tahoe Wildlife Care Organization nonprofit in South Lake and previously ran the Martis Fund. So the Martis Fund has a down payment assistance program that Heidi helped to bring to fruition, and we worked together on the Mountain Housing Council, and she also helped to administer dollars to bring affordable housing to the Truckee-Tahoe region during her tenure at the Martis Fund. So very, very honored to welcome Heidi as the incoming executive director, and if you'd like to.
Yeah, thank
say a
you.
few.
Thanks for having us tonight. Really appreciate it, and honored to take over this role that Emily has done such a fantastic job. I've witnessed over the many years of this growth of this organization. So very excited. My family and I've been in this community for over 15 years, and the Tahoe Forest Health System has been what we've utilized this entire time, and I love it. If my PA ever had to move because she didn't have housing, I would be very upset, along with all the other 20 other people. But it's a fantastic organization, and I'm really excited to help move this strategic plan forward over the next 5 years. So thank you. Thanks for having me, and thanks to Emily for all that she's done in our community.
Emily, you're not going to get away with anything yet.
Yeah, I was going to say, questions.
Yeah. We're going to open it up to questions.
Yes, please.
Any questions from our board?
Yes, I do. Inasmuch as you're constituted by the member agencies, why would you also be availing services for the general public,
Yeah.
given limited resources?
Right. So over the last few years, especially because we founded this agency during a pandemic, we recognize that a lot of the services that we've been administering can really easily translate to a greater community. And we had a number of boards, including yourselves at times, say, well, we could be doing these same things for so many. The only way we can do it, though, is if we're unlocking additional funds in addition to your member fees to help us to do so.
Yeah.
So part of that strategic plan is we need to unlock public and private dollars outside of what the hospital and our other member agencies are contributing to be able to do that. One of the ways that we're doing is what we're calling the Workforce Housing Fund. That fund is what that $10 million is going to sit in. And those dollars are going here into the general workforce, while some of our member agency dollars are going here and staying with their employees.
Mm-hmm.
So we're not shifting away from serving member agency employees. We're basically adding a layer to serve the greater workforce. And programs like your down payment assistance program and the way in which we help your employees access for purchase and rental housing will not go away.
So the general public effort is not necessarily competing then with what you're doing for the other
It's
member
almost a
agencies?
tiered system. So we're looking at member agency employees and the services we provided over the last 3 years, and then the general workforce. So for example, the rental program that we have, we still advertise homes only to your employees for the first few weeks. If we can't find an employee to fill that home, we actually are expanding to serve the greater community. What we found with rental homes in particular is when you have a small, 2,300 isn't small, but when you only have a few of those people looking for houses, it can be hard to actually place someone in a house at the time that the house is available. If we can expand to serve a greater community, it means we're going to get a local in that house no matter what. Yeah, so looking at kind of different ways to serve while still serving your employees.
Okay. And then one other quick question is, how has this rise in interest rates impacted your efforts?
It actually hasn't. We're actually seeing an increase in interest in our community for home purchase. And I think it's because at the same time the interest rates are rising, there's all these programs with funds coming available, like all the down payment assistance programs we have. And so we saw about 3 months of fear and silence as interest rates were rising. And now we're actually seeing more activity from locals interested in buying than we've ever seen before.
Okay.
Yeah, so we'll see what it looks like in the long term, but so far we haven't seen people kind of running away and stepping away from looking for homes.
Okay.
Yeah, we just need more housing stock.
Yeah.
Yeah.
So that's a good question you bring up, though, is the employee finding a house and then coming to you and say, how can I get this house? Or they come, I want to find a house?
Yep, it's usually that. So we have employees coming to us and saying, this is how much I make, this is my family, we have 4 people, we make this much as a household. What can I do? Could I ever buy a home? And what we do is actually walk them through the process of connecting with a lender. Once they get their numbers, they come back to us, and we're all working together to help them identify if it could work for them. On the rental side of things, they always come to us first. Yeah.
Okay. Any other questions from our board for Emily?
Good
Or
luck to
Heidi?
you.
Either one? Any questions or comments from our, Harry?
I just want to say a big thank you to Emily and her team, and also to our other partners with the Workforce Housing Agency. She's done a superb job. We're sorry to see her go, and also happy to have Heidi join us. And it's been a privilege and honor for me to kind of support them and their really tough work it is really hard work. As you all know, housing is probably the number one stressor, unresolved societal issue and in our region. And so we're really happy to have them, and we hate to see you go, and bless you in your future career.
I made it through this without crying.
Yeah,
so. And I have to say one more thing. Whenever I'm feeling very challenged, Harry reminds me that he thinks my work might be harder than his. And that feels pretty good because he's running a very large health system. So.
Any comments from all? Okay, well, again, thank you
very
so much
Yeah,
for
thanks for
all
your
the
time
work
tonight.
you
Appreciate
did.
it.
We wish you well, and your new community is really getting an asset. Thank you. And welcome, Heidi.
Thank
Look
you.
forward to meeting with you.
We'll see you soon.
Okay. So we didn't pull anything from our consent agenda, so we'll move on to item 16, board committee reports. And Quality had a meeting this week, correct? Did Quality?
We did.
Okay, then you're on.
Holy cow, I don't know if I'm prepared for that.
You could defer.
Completely spaced it. Yeah, I'll defer. I'll report next, because it's a quarterly report. My
I
apologies.
took a few notes. I can kind of follow up. We met, the quality meeting was on the 21st, just recently. And we talked about the patient experience. We talked about the context in which we view the patient experience, our partnerships with doctors, and what the options were for that in relationship to the patient experience. We focused a lot on how to achieve better results using the process versus outcomes for the metrics that we're using. And we felt that it's kind of like going to the base root of problems instead of just looking at the problems. By being more process oriented, we think we can produce better outcomes. So those were the issues that we focused on.
Thanks, Director Barnett, for that. Any other committee meetings this month? How about Foundation?
Foundation met?
Yes.
Yeah. Foundation met and actually had a fairly brief meeting. 2 items probably to report on. They shared out the annual fundraising for last year, which was just shy of $1,993,000, which was a little bit, I guess it's right in line with the past few years. So still continuing a great job there. And then the other key conversation that the group had was really around expanding the size of the board, feeling that they need a little more participation, from the community. So they're having an interim meeting, I think, next week on actions they might take. They've got a few interested members of the public that have expressed interest in joining, so they're likely going to be expanding the number of board members.
Okay, thank
That's
you.
it.
And the Incline Village Foundation also had a meeting, and we're pretty happy with the results of the Beach Boys concert. Crystal, if I remember correctly, $1.5 million gross, maybe 1.2 net? Is it 1.5 net? Oh.
Wow.
Oh, yeah, that's right. Yeah. Unbelievable. So.
Good for them.
Yep.
Okay, are there any other reports from our board members? No? Any closing remarks? Okay. Without any of that, meeting is adjourned.
Thank you.
Oh, you get to go home. You get to go home.